Hello everybody and welcome to today's Brenda Strafford Foundation Town Hall for our staff on the topic of COVID-19 immunization. My name is Julie Arnold and I'm the Manager of Communications and Marketing for the Brenda Strafford Foundation. And today we will have an expert panel including our President and CEO, Mike Conroy, Dr. Shankle, who is a Medical Director for the Foundation, as well as Dr. who is a Zone Medical Officer of Health for the Calgary Zone with Alberta Health Services. Today's format will be an overview presentation regarding the COVID-19 vaccine, and then we will move on to some questions which have been submitted by some of our staff. So I will start by introducing Mike Conroy, President and CEO of the Brenda Strafford Foundation.
Thank you, Julie, and hello, everyone. As you well know, the situation internationally, nationally, and provincially is not good. We are experiencing a record number of cases in the community, in the number of continuing care sites on outbreak, the number of staff and residents who are infected with COVID-19, and most tragically, the number of deaths of residents in continuing care. And the situation is far worse than it's ever been, and certainly as compared to the first wave. And Alberta has been hit particularly hard. This is affecting all of us, and if we don't do something about it, something that can have a permanent impact, the situation will only get worse.
Hi, everybody, and thanks, Julie. There is only one solution. The COVID-19 vaccine is now beginning to be provided province-wide to respiratory therapists, ICU staff, and physicians, and continuing care healthcare workers in Alberta. Yay. This is the most significant development and a momentous occasion in the fight against the COVID-19 pandemic. This is the hope we've been waiting for. I am so grateful that long-term care has been prioritized for the initial round of vaccines. Our residents are the most frail members of our communities and have been the most affected by this pandemic. The death rate from COVID infection in long-term care residents is about 1 in 4 or 25%. This is a shockingly high number. I am especially grateful that the staff at 2 Brenda Strafford sites have been selected for having a higher risk of larger outbreaks and are therefore going to be among the first healthcare workers vaccinated. This is truly a historic event, and I am really pleased that long-term care health workers are finally getting the recognition they deserve. Next slide, Julie. Thanks. We know that the staff will have some questions about the vaccine. The purpose of today's town hall is to provide assurance to our employees, to present some expert information about the safety of the vaccine, and to answer some of your questions, which have been submitted in advance and will be addressed by Dr. Hu. The BSF staff have an envious record of the percentage of staff getting vaccines. Like all physicians, I am a strong supporter of vaccination to prevent disease. It is the only solution. And I'm sure that BSF staff will continue to keep our great record of getting staff vaccinated. Why is it so important that we get vaccinated? This is not only our best, it is our only opportunity to protect ourselves, our families, and each other and our residents. When you come to work, you're going to feel like you're bulletproof. And our sites are now going to be the safest places to be in our communities because our staff will be vaccinated and very shortly our residents. We will be a COVID-free zone. We should even get a sign. And now I'd like to introduce Dr. Hu is the Medical Officer of Health, who has been so helpful to all our sites in helping us maintain our safety and handle outbreaks.